Enter the room.
Hello, James number 8089937. Hello. Please
Hello.
proceed. I'm Dr. Amwa, one of the doctors in the medical unit. Can you confirm your name for me, please?
Sure, I'm Mrs. Thompson.
All right. How would you like me to address you?
Mrs. Thompson is fine.
All right. I understand you are here regarding Mr. Thompson. Is that right?
That's true, yeah.
Can you confirm your relationship with him?
Yeah, he is my husband.
Can you confirm his age?
He is 55 years old.
I understand you have some concerns. Can you please bring me up to speed?
Yes, I mean, I don't know where to start. I'm totally confused, doctor. I don't understand what's happening with my husband. Some days ago he was brought here for some COPD condition of his. Now he has been changed to another room, and everybody is, he's isolated basically, and everybody is behaving as like with gloves and like some kind of degenerate. I don't understand. Like it's like he has leprosy. Is what's happening? I don't understand. I'm like really concerned about this.
All right, Mrs. Thompson, your concern is valid, but before that, I'd like to ask you some questions about your husband's condition, and I'll address it shortly, okay?
Okay.
All right. And what do you know regarding your husband's condition?
Well, like I told doctor, like he was brought because he has COPD. All right, he has been having it for quite a while now, and just flared up, I think, and had to bring him. And I understand that he has been completely treated. Just don't understand what's happening now, and I'm really afraid of really. But that's what happened.
All right. And is he on any medication?
No, apart from no, he doesn't actually take anything apart from no,
Any allergies?
no.
By chance, do you know whether he smokes?
Sorry, can you tell me that
Do you
again?
know whether he smokes?
He was a smoker. Now he doesn't smoke at all.
Does he take alcohol?
Sometimes, like in occasions.
Mm. And when was the last time you saw your husband?
Um, 3 days ago, I would say. I haven't been able to, talk to him because he is in a room and nobody tells me what's happening, and I'm really anxious.
Do you have any idea what may be going on regarding your husband's condition?
I don't know. Nobody has told me anything. I'm really worried about, what's happening. I really am hoping for to hear something from you.
Yeah, I understand, Miss Thompson. This might be quite um alarming for you. It's good you are here. We'll do our best and then explain it to you, okay?
Okay.
Do you have any other concerns regarding Mr. Thompson?
Uh, no, I'm just worried for my husband, and it's no, it's hard not knowing what's happening, and you can't see your husband. It's not something normal, is it?
Yeah, I can imagine how you feel now. Seeing your husband being put in a different room and with him being alone there. Well, I'll explain it to you shortly. You are right, as you said, your husband is being managed for COPD and he's doing well, as you said. And so he had this flare up and when he came to the hospital. And normally when people come to the hospital, and we do this test for them called the MRSA. Have you ever heard of this?
Oh, MRSA, isn't that the super bug?
Yeah, that's this methicillin resistant staph aureus bacteria bug that is mostly found in the skin, in the groin area, and sometimes in the nose and in the armpit. Do you follow?
Yes, now I'm even more concerned. If does he have it?
Well, we did a test and then it shows that he has it on his in his nose, colonization in his nose. And actually, he doesn't have the infection now, but he has it.
I don't understand. What do you mean, like colonization? So he is infected, or I don't understand. What's the difference?
Yeah, and so he has it on the surface of his nose, the lining of his nose. It's not in his blood causing him any infection signs like fever
Okay.
or making him unwell. But due to the serious nature of this condition and how it can spread to other people, normally we put them in a different room so that we could treat them to prevent the spread of this condition. How do you feel about this?
Uh, to be honest, doctor, I'm even now more concerned. I mean, what if he has the infection now, and you guys don't catch it?
Well, for now, it will be hard to say. Normally, this bug settle on the skin. Um, so for now, when he came and we did it, we may have to investigate further to know how he got it. Okay.
Okay, but
Well,
okay.
right now we are a bit concerned about managing your husband. So what we do is that specialists will come and see him. We will give him some wash with using antiseptic lotions and also some antiseptic creams in his nose for about 10 days. That could also help clear out this bag. What do you think about this?
Is he going to be okay?
Well, with this treatment, hopefully he will get better.
No,
2 minutes remaining.
and if you promise that, I mean, if you're gonna take care, I can understand. So, but when can I see him now?
Well, I'll discuss with my seniors. You can see him, but there are certain safety precautions you may have to put in place. You may have to wash your hands and wear some safety and personal protective equipment like the aprons and the gloves whenever you want to see him, in order to protect anybody from getting this bag. Okay.
Okay, okay. I think I follow you, doctor. Okay.
All right. Do you have any other concerns?
No, I was. Thank you for explaining this. I was just really, anxious. Like, I mean, I could understand. Nobody explained it to me, and now I have some, air to catch. I feel relief a bit. Thank you for that.
Right. I'm glad you do understand. I also like to advise you and give you some advice. And maybe you could also see your GP, where they could also carry out this investigation, the MRSA test on you, in order to protect you and other people too. What do you think about that?
Sure. If you say if it's needed, okay.
All right. Thank you for understanding. And is there anybody else at home?
No, we are together. No, nobody is there.
All right. And I must commend you for being supportive and a caring wife for your husband, okay?
Thank you for that, doctor. Thank you.
So I'll give you leaflets on MRSA so that you could read more about it.
Okay, that
And
will be great. That will be great.
all right. Should you get any concerns, please do not hesitate. Do let us know, okay?
All right. Thank you very much, doctor. Thank you. I really appreciate the time.
Do you have any other concerns, miss?
No, no. I'm really happy that you have explained everything very good for me. Thank you.
All right. Thank you. I hope I've been able to meet your expectation for today.
Yeah. Thank you, doctor. Thank you.
Wishing Mr.
Move
Thompson a
on to the
speedy
next
recovery.
station.
Thank you. That was good.
Thank you. Thank you, Doctor. Thank you, Dr. Nevin. Very good consultation. Dr. Nevin, do you have any feedbacks?
Sorry. I mean, I think it was quite good. I mean, the way you approached it, it was quite humane. It was more patient-centered. Um, I think overall you did very good, very good. I just have a comment that I felt in somewhere along the lines your IPS could have been a bit better in the way you were giving the information. It felt very robotic. The last place where how you were presenting the information, like regarding the treatment options and how you were suggesting to go to the GP. It was felt very much robotic for me, like a reading from a screen. So I think this might be something that you could change to be more humanistic, maybe. Like the way it's not the information itself, but the way you approach it, the giving part only. That's the only thing I could maybe comment on it.
Okay.
That was a good observation. And I just to add on to that, there are some cues where you can actually act upon that can actually, put across your interpersonal skills. Like when you were asking about smoking and alcohol, you should signpost it because if these are all sensitive information that you don't want to make the patient uncomfortable about, right? I'd like to ask you some personal questions if that's all right. And then go ahead, like, give a warning shot before you go ahead to ask any private information. And a couple of things that I wanted to point out was that this station is actually a little tricky because it not only tries to understand how you deliver the news, it also you should also know the difference between the colonization and infection. So this is not a condition that he's suffering from as of now, because there is only colonization. It hasn't gone into infection. So every time you're calling it a condition, there is no condition. The condition was the COPD that he came with, right?
Mm-hmm.
Right now they're isolating him because they found a superbug, and this is what the problem is. You don't want this bug to spread. So hence, since we have found this bug, that's why we want to make sure that it's not in his on his surfaces anymore, because that's all there is. It's just on the surface. It's not causing any infection. So this is what you need to put across. So if you actually meet this person in the hospital, if the wife actually approaches you in the hospital saying that my husband is shifted to another room and everybody's wearing gloves around him, why is this happening? This would just be like a 2-minute conversation where it would be like, no, it's all right. It's just that they found a superbug on his skin surface. It's not causing infection, but it's all right. It's just we're just taking precautions that this bug doesn't spread. That's basically the interaction that you will have for this, right?
Yeah.
But in this kind of a scenario, you are supposed to put across everything that you need to know about this patient, making sure that he's all right, and at the same time, you're being, empathetic and sympathetic to this relative who's come to you, trying to understand what is causing her this anxiety, right? And addressing it by giving the right kind of information. All
Mm-hmm.
right.
Yes.
So that's what you're trying to explore. So when you're asking all the personal questions, or if you're asking any history from the patient, you need only that amount of history that will be required to deliver your news, right? So the one thing you need to understand is, why did he come to the hospital? What was he admitted for? Is that underlying condition all right? Is he better now? Great. Now, when he was tested, who was he around? The contact history, that also you managed to cover. That's very good. And after that, so that's all the history part, because this is not much of asking questions. So we have our master, Dr. Umar, is ready with the results. So we'll move on to Dr. Umar. He'll give you a detailed feedback. Yeah.
Okay.
Hello, how are you?
I'm fine, doctor. And you?
Hey, so nice to meet you. So it was a very great session, okay, and you did really good. And there were some, ups and downs which I would really like to discuss, starting from, from the start. Like your introduction was really on top notch. Okay, you greeted the simulator, the patient really well. You confirmed her identity and her relationship, and you used open questions, which are, some key points in marking schemes of PLAB 2. Dr. Ann and Dr. Navin really explained the things. Whenever a patient attendant or the a simulator comes to you regarding another patient who has been admitted in the hospital, always ask the understanding of them.
Mm.
What's the condition like? What does Mr. Thompson suffer from? How has he been treated? Is he doing well? When did you last meet him? And any concerns about COPD? It. All these questions just make a good relationship with the patient's wife, so that she can trust you and she can deliver her emotions to you as well. Apart from that, you really gathered the past medical history, family history really good. One thing that I thought that could have been added in data gathering was, the effect on psychosocial history
Mm.
or, effect on life of COPD. Like, when did he develop COPD? Has it developed, has it affected his mental, caused him any depression, taking medication, anything that has affected his daily life. So I think you could have asked that question. Other than that, data gathering was really on top notch. Moving
Mm.
on, your eyes, ideas, concerns, expectations, your flow of English, everything was good. Your management, you explained MRSA really good. What's colonization? What's infection? Okay, how is harmless or harmful? How does it spread? You explained the hospital measures. Why we isolate the patient and everything else. You like also explain the treatment options. In management, I think that you could also have mentioned the follow-up. Like you could have said that we could arrange a follow-up for ongoing evaluation and support. Okay, because the wife is really concerned and anxious about about her husband. Okay, so you can reassure her that don't worry, we are here to help you. You can add these IPS skills, interpersonal skills in your conversation. Another
Mm-hmm.
thing, when you mentioned the leaflet point, you could have
Mm-hmm.
also mentioned the safety netting. Like you
Mm-hmm.
can tell the wife that if the condition worsens, or you can tell a couple of symptoms of MRSA that if it develops, she should seek medical help. It will really help the wife understanding the condition, what's the severity of the MRSA right now.
Mm-hmm.
You following my point?
Yeah.
Okay. So one more thing that I also noted in this uh, scenario, it's really important, to drag on time and make a very comfortable relationship with the simulator. Okay, so when you ask the wife about the smoking and alcohol habits, you could have, uh, mentioned that I would really like to ask a few personal questions about your husband. Are you feeling, is it okay to you? You can have all mentioned that just give a heading that I'm going to ask a few personal questions to mentally prepare them.
Mm.
Okay, it also
Okay.
adds in your interpersonal skills. Now mentioning about your interpersonal skills, your empathy and your tone was really respectful. You used a clear and simple communication without any medical jargon. Okay, you maintained a professional boundary. You acknowledged the wife's positive efforts towards her husband. That was really good. But you could have also mentioned about the follow-up and also reassured her. Other than that, one thing majorly that Dr. Nemin also mentioned that I also felt it. Your tone at the end was kind of robotic. Okay, it
Mm-hmm.
didn't have the variety of the amplitudes. It felt like that you have memorized it and now you were just reading out the script. Okay, so you could have delivered all those points in a very empathetic way. Other than that, this scenario was really, really good. You completed all data gathering, management, and IPS. It was a very good scenario, and hats off to you. Any question that you have?
Yeah. Regarding the safety net. So the safety net, I would have safety net on some of the symptoms of the MRSA. Re-
Sorry, I didn't get you.
I'm asking how I would have done the safety net.
Safety nettings.
Yeah,
Yes.
safety netting, like, yeah, in the management part, there are three things, leaflet, safety netting, follow-up. Okay, these contain some points in PLAB too. Examiners have made a marking scheme, looking out for these words or these sentences. So when you mentioned about the leaflet that you are providing a leaflet on MRSA, you could have also add a sentence that if such symptoms develop or if the condition of your husband worsens in future, you always need to come back and seek medical help. Okay, or you can have add this sentence when you mentioned about the GP that if
Mm,
you ever his condition got worse, then you can just go to your GP and he will refer you whatever he wants to do. Okay, so safety netting is really an important thing in every scenario of lab too.
okay. Mm,
You
Just to
got my
add
point?
on, yeah, just to add a point to that. So all the safety nettings that you will be giving, it will be very, it will be tailored to the situation or the case that you have in front of you. So in this case, if you see it's COPD with MRSA colonization. So thinking about this patient, what safety net should you give? Should be the thought process. So knowing that, so if you had asked whether the COPD was properly managed, so then she would probably say, yeah, he has no issues like that. So you could also give a little safety netting about COPD, and since he's already being treated for the colonization, you could say that he should be fairly all right. But just in case, if you see that there is any infection, redness around the nose area after a few days or after treatment, please do contact the GP, right? So looking at the situation itself, thinking about how this situation or how this condition can become worse, you
Yeah.
know.
So the rule of thumb is just think about what is the worst thing that can happen to this patient.
Hmm.
So like that's a very good thing to have at the back of your head, which is basically it helps you during your data gathering as well, which is you can rule out red flags, right? Always think about, even when you see in the beginning, when you're reading the case itself, think about what is the worst thing that can happen to this patient. So you can ask in the red flags, you can give safety netting. So you can cover both data gathering and management if you think about it that way, right?
Yes. All right. Thank you.
Do you have any other questions for us, Dr.
Yeah. Also regarding the follow-up, do I have to mention a specific date, or I mean weeks, or I should just say you would appreciate you to come for a follow-up should you have any concerns?
So the thing is, you don't have to be very specific unless it's only for, unless you're sending them to a specific emergency situation. Like suppose you have suspected cancer, you have a patient with suspected cancer, then you have to have them be seen within 2 weeks, right? Only there are very few situations where you have to be careful about the time that you mentioned. But otherwise, generally, you can just say that I'll see you again in a few weeks. That basically, and you don't tell them to set up a follow-up appointment because they won't be able to do that. It's basically in your hand. You have to give them a follow-up appointment. Basically, if they want to, they will come. Otherwise, they don't need to. So you can tell them in a few weeks, I'll give you a follow-up appointment. If you have any issues, you come back and see me.
All right.
And so follow-up is again another thing that you've seen a patient right now. So this will be an A&E setting. So in this case, you're in a hospital and this is an A&E setting, and the patient has been admitted before, is admitted. So, but it's not like once he's been treated, there is no more disease. Like there is no more, what happens to the patient, you have no idea. So he's still in the system. He has had an infection. He has had a COPD exacerbation. After that, what happened? So he needs to still continue, updating the system about his condition, or else, following up to understand how much his condition has progressed. So we have to make sure to tell patients that even though you have been treated right now, but make sure you do have regular follow-ups to see how much it's progressed, or do you need adjustment to the medications, or is the current medications working. So that is the whole point of follow up. Like just one time after you meet the doctor, that's not enough, because conditions need to we need to make sure on a different occasion that he has been properly treated.
Okay.
Yeah.
Yeah.
When you're thinking about the COPD, in this case, you would be actually asking the patient to follow up with the GP about the COPD issues, and then telling him that, if you see any red flags, or if you see there is any signs of infections, so make sure you definitely go to the GP or come to the emergency to understand what's going on.
All right.
Yeah.
Thank you.
And other than that, I think you are very knowledgeable. You are asking all the right questions. You are giving all the right information. Only thing you need to keep an eye on is try to be more personal. Like try to make it look like you are actually talking to a person, and you're not like just attending an exam, right? That just comes with practice. You just keep doing this, keep looking at yourself in the mirror while practicing, while saying these things, so that it doesn't come off very like rehearsed, right? So it just that just happens with practice. You just keep doing at least 2 or 3 cases every day, and other than that, you're doing really well. And when is your exam, by the way?
25th.
25th of Jan.
Yeah.
Perfect. You have plenty of time. Don't worry. So just keep practicing. Don't worry too much about what knowledge you need to give, what everything that you need to cover and things like that. Just keep it. Always think about what the patient might be going through. So it becomes very difficult in the during the exam to see them other than see something other than as a question paper, right? You'll as soon as you enter, you'll think about like, okay, so this is a question, I need to answer these things. So always think about, what if there's a relative who's come to you with the same problem, how would you talk to them, right? That has to be your mindset when you go to the exam. That's the best way to actually keep the conversation very natural.
Natural.
All right. Do you have any other questions?
No. I just think regarding the how robotic I was, like maybe for now I'll be wondering how to go about it. As you said, maybe when I listen to how other people practice, is it I should slow down or the tonation?
Oh, actually, don't worry too much about it. You did really well. Easily pass. You would have easily passed the station if you had done this in the exam. These are just things that you just have to keep in your mind. And so at this point, the way to think about not being robotic is if you're saying something, you make sure that you're looking at the patient you're looking at them in the eye, and you're saying that with gaps in between your words, right? Like if you say a sentence, make sure you say three words and then at least give a pause and then you say another three words. I mean, it comes with practice. And don't think that, don't take it as a negative point that you're being robotic. That's just something that happens with everyone. That's not an issue at all. The only way is to actually keep practicing so that it doesn't come like you just read from a paper, right?
Thank you.
Thank you, Dr. Pep. And you can actually see a lot more of these practice sessions on our YouTube channel. We have a lot more of these mocks where, other students have also practiced and they've done fantastic in their exams. So far, we've seen that all the students who have actually done a mock with us, all of them have actually passed. We have our masters also who have been part of that pool. So don't worry about it. If you have any questions, please don't hesitate to ask on the group. We'll try our best to answer them.
And you'll also get a recording of this session as well. You just make sure you watch yourself and see. You judge for yourself, because don't take other people's words for it. Whatever other people are feeling that you're robotic, you might feel that it's all right. So it's okay. So just go through it, see where you are finding that it's not natural, and then you can easily correct it. So best way to do this is actually just watch yourself do the session. See, if you're practicing again, try to record it and then watch it back again.
All right, thank you.
All right, Dr. Peb. All right, thank you everybody for joining us and have a happy new year.
Right. Sorry, can I? Do you have a score for me or we
A
can?
score for you. Yes, Dr. Umar.
Yeah, yeah, I did score you. Okay, I gave you 3 out of 4 in data gathering, 3 out of 4 in management, and 3 out of 4 in interpersonal skills. Considering your performance, it could have been much better, or if you have done same in in real life PLAB 2, you could have got much more marks. We are just trying to be strict right now so that you perform well in the PLAB scenario in the real life.
Yeah.
Okay, it's just a practice session. You did really, really well today.
Thank you.
All right.
Happy New Year.
Thank you,
Okay, bye-bye.
everybody.
Thank you, everyone.
Bye, guys. Happy New Year as well. Thank you.
Please like and subscribe to Turing Med School. Good luck with your preparation.